Most people are not aware that there are 3 hidden causes of lumbar spinal stenosis. This is a serious and debilitating condition, and if people understood more about it, they could take the proper steps to actually help correct this. Lumbar spinal stenosis doesn't just cause pain, it will severely limit your lifestyle, your ability to walk, your ability to stand, your ability to do the things that you want to do. Learning the underlying causes of the lumbar spinal stenosis is key to getting the most effective treatment at the right time. Now, lumbar spinal stenosis is a complex condition, but understanding it doesn't have to be. Today, I'm breaking it down in a way that anyone can easily grasp. In addition to relieving pain and bringing your back to normal, one thing with lumbar spinal stenosis especially want to avoid is surgery. We'll get into that, some significant negative side effects, and often don't really cure the underlying cause of the problem. Now, while typical treatments for spinal stenosis often fall short, I've discovered a unique and proven treatment method that's changing lives, and I'll reveal it to you in this video. Now, we're not talking about temporary fixes. We're not looking for temporary relief or masking the pain. We're looking for long-term correction. This treatment offers really a transformational change. Imagine relieving your pain, avoiding the back surgery, and again, that back surgery often leads to serious complications or relapses. Now, our approach is not only safe and reliable, but also proven with consistent results. Later in this video, you'll actually hear the story of Jeremy, one of our many patients who've experienced remarkable recovery without the risks of surgery. His journey is a testament to the predictability and effectiveness of our method. Now, also, please do watch right to the end, because I'll give you a bonus tip. I'll share an incredibly easy exercise, one that is actually not only highly specialized and yet so simple, specifically designed for lumbar spinal stenosis. Not only do we utilize it in our health center, but it's also used in some of the top hospitals in Toronto as well. It's so simple yet effective that anyone can do it to start experiencing quick relief. I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been practicing for over 30 years and have literally put my hands on hundreds of thousands of spines. I'm very honored to say that we've been voted Ottawa's best 15 times by the Consumer Choice Awards and the Top Choice Awards. I also am the past director of rehabilitation at the Ottawa Sports Science Centre here in Ottawa, so I've also been privileged to have cared for some of the world's best athletes. The author of 10 books, including 3 bestsellers, and I'm also the founder of National Health Day here in Canada. My YouTube channel focuses on helping those who are suffering with chronic, debilitating low back and neck pain. Now, before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. When you do so, please tell me in the comments and I'll personally respond back to you as well. So what exactly is lumbar spinal stenosis and why does it cause so much pain and disability? Well, to understand that, let's take a step back and let's have just a brief understanding of what the spine and the nervous system actually does. Your entire spine made up of these guys. You want a vertebrae. There should be a nice thick disc that's going to basically work as cushioning and support for the spine, protection as well. Then you'd have another vertebrae, there'd be another disc, another vertebrae, another disc, another vertebrae. Coming off each level, the yellow guys you see here are the nerves, and those nerves come right off the spinal cord, which is inside here. That spinal cord goes up to the brain, and that nervous system really is your body. Think of it as the hardwiring of your body's own computer system, or think of it like your body's internet system. It controls everything that's going on in your spine. Now, let's maybe move to a bigger model, a little easier for you to see. How's this for size? Okay. So again, vertebrae, disc, and so on. Yellow guys are the nerves. Okay. And then remember, those nerves come right through the canal in here. This is the spinal canal, which the spinal cord runs through. Spinal stenosis just comes from the Greek word meaning narrowing. So it's the exact same thing when you hear about stenosis in heart disease, for instance, is the canal starts to narrow. Either the canal narrows or something's happening that is actually causing compression on that spinal cord right on the inside. That's why it can create such more serious effects, because you're no longer just affecting the nerve, now you can actually start to affect the spinal cord itself. And when you do that, you're going to get the low back pain. Surprisingly, not always at first, but significant debilitating low back pain. You're going to get the numbness, the tingling, the pins and needles that actually start coming down the back of the leg. Remember, those nerves actually also go to the organs in that area, so they can affect your bowel, your bladder, your reproductive organs as well. It's a very serious condition called Aquinas syndrome, where there's so much pressure on the spinal cord of the nerves that you actually lose your ability for normal bowel or bladder function. That becomes emergency surgery. That's obviously something we want to avoid. It will affect muscle weakness. Remember, those nerves also control those muscles as well. And it just really becomes a debilitating disease, most affected when you're standing, when you're walking, when you want to do all the things that you really want to do in life or need to do in life as well. So that's one of the interesting things about lumbar spinal stenosis, and it does happen in the neck as well, is you can have different causes that are actually creating that narrowing that's putting that pressure on the spinal cord, on the nerves inside the canal there as well. The three biggest hidden causes, number one, is osteoarthritis or degeneration of the spine itself. So if I use the terms degenerative disc disease, degenerative joint disease, spinal decay, spinal deterioration, osteoarthritis, they all mean the same thing. So the best way to explain that, let's get back to our smaller size models, is again, we want the nice thick disc. The thicker the disc, the more room for that nerve to come out without it being obstructed in any manner. Through wear and tear, through chronic work postures, through old injuries, that disc will actually start to thin out. When it thins out too much, the body will then start to grow bone. It's what we call spurs or osteophytes, and its goal is to fuse you together. Well, understand, those spurs or osteophytes can also work inward into the canal itself as well, or backwards towards the spinal cord itself. That can be a big factor in adding to your stenosis. Number two is you can have what we call a disc herniation. So again, let's get back to the small model. And again, we want that nice thick disc. In this case, look what's happened, is you can see that's a disc that's now starting to bulge or herniate. And again, usually through injury, can come through weakness, can come through a number of different reasons. But that disc, depending on where the disc is going, if the disc bulges solely outwards, it's not going to cause stenosis. If it bulges inward, then we can, in fact, get stenosis. And you're affecting that narrowing inside the canal itself. Number three is one of my favorites. It's what we call spondylolisthesis. I use that term loosely when I say favorite, but it's one that we see a lot of in here as well, and a lot of people have been told that it can't be helped, and it really can be helped. Spondylolisthesis, on top of everything else, whether that disc is degenerating, whether you have the osteoarthritis, whether there's a disc herniation, whether any of those things put excess pressure on the nerve and then give you that sciatica. But what happens in spondylolisthesis, there are also strong ligaments that hold the alignment of these vertebrae in place. In spondylolisthesis, you actually get a shifting forward or backwards of the vertebrae. And if you get that shifting, again, impossible not just to put pressure on that nerve, but understand you're then tensing the spinal cord inside the canal as well. If that shift, if we're referring to the one vertebrae on top of the other and it's moved forward, then we call that an anterior listhesis. Anterior just means forward. If it's moved backwards, we're going to call that a retrolisthesis as well. This becomes so important because there are some, believe it or not, some credible websites out there who believe that that can't be fixed. That actually can be addressed as well. But that's one of the keys, is we need to determine what is the actual underlying cause. And rarely is it cause, it's usually causes as well. People often have 1, 2, 3, 4 things. They may have the spondylolisthesis plus the disc herniation, plus the degenerative disc disease or osteoarthritis, and all three of those things then cause the lumbar spinal stenosis. Now, this also becomes especially important when we start talking about surgery, because what happens is if you let any of those hidden causes continue to progress, whether it's the degenerative disc disease, whether it's the spondylolisthesis, whether it's the disc herniations or bulges and so forth that are actually coming backwards onto the cord, is eventually they're going to tell you that you're going to need surgery. And the catch-22 with that is it may get so bad that some pressure has to be taken off from the inside, but at the same token, surgery has with it so many risks. We're no longer talking about a simple discectomy, so that's something where if the disc had just bulged outwards, you simply slice off the disc. That has a reasonably good success rate, and a lot of times people are back to normal if that's all that they had. When we start talking spinal stenosis, lumbar spinal stenosis, you're now getting a number of different factors, and you're now also getting right on the spinal cord itself. So the risks shoot way up. That's not something that we want to do if we can avoid that, obviously. And then even when the surgery is done, the success rate is not great because often it doesn't address all of the causes that actually brought it on in the first place. So in fact, a study out of the Journal of Pain showed a 72.6% failure rate when it came to surgery, and 1 in 3 were actually back in the hospital within 30 days. That brings us to this new and revolutionary treatment, non-surgical robotic laser spinal decompression. The interesting thing about non-surgical robotic spinal decompression is that it's actually not new and revolutionary in the sense that this is something that's just been discovered. What it does, what's new, is it's actually combining two different well-established, scientifically based forms of treatment, and for the first time has put them together simultaneously. So think about this, right? Is if we have pressure on this disc, on this vertebrae, especially on this nerve, what on earth makes more sense than to take the pressure off that nerve? That's what spinal decompression is supposed to do. It is different than traction or inversion tables. Anyone who tells you that traction and spinal decompression are the same things, unfortunately doesn't know what they're talking about. Spinal decompression was actually invented by Dr. Alan Dyer, PhD, medical doctor, former Minister of Health for Ontario. The difference is in spinal decompression, you're actually causing a decompressive effect right inside the disc. That's going to be like a vacuum effect that draws fluids and nutrients back into the disc. It actually rehydrates the disc, and it's going to give you the long-term benefits. Now, what happens with a lot of standard spinal decompression is if I attempt to do that to the spine, what does the spine want to do? It says, thanks very much, but we've been used to that. It's going to resist. So that's what makes non-surgical robotic laser spinal decompression so different. For the first time ever, we've combined the two simultaneously. We have the only system in all of Ottawa. There's only 12 in North America. The difference is at the exact same time that you have the robotic laser spinal the spinal decompression going on, is from underneath the system comes a class 4 laser. So class 4 laser is the highest level of laser that's approved by Health Canada and the FDA. It's going to do two things. Number one, it's going to ease up all those muscles so that when we do this, the body doesn't resist. It doesn't want to go back to how it was. And number two, you've done damage to the area in there. A class 4 laser is going to help to heal that damage as well. Now, how this works specifically as far as lumbar spinal stenosis goes, again, this is why it was key to determine what was the actual underlying cause that's causing the stenosis. So again, let's take these one at a time, our three biggest ones. If it was in fact a disc herniation that was causing the lumbar spinal stenosis, well, what a surprise, if I take that pressure off there, that disc can actually recede. Number two was if it was that the spine was actually degenerating, the osteoarthritis, the degenerative disc disease, the spinal decay. Same thing, if that spine is degenerating, what on earth makes more sense to take that pressure off that spine? And then remember, number three was our spondylolisthesis, where the vertebrae had literally shifted on one another. Well, guess what? If I take that pressure off, often we actually see a realignment of the vertebrae as well. That's a topic for another video, but we're seeing some amazing results where we're literally seeing on x-ray how we get better alignment in the spondylolisthesis as well. And as I may have said before, is often people have more than one thing causing the lumbar spinal stenosis. The nice thing about the non-surgical robotic laser spinal decompression is it works on all of these things at the same time. Now, a perfect example of this, we have many clients who've gone through our programs, but a perfect example I'm thinking of is Jeremy. Jeremy is a 30-year-old male, excruciating, debilitating low back pain for years, had tried so many different things, whether it was chiropractic, physiotherapy, massage, been to orthopedic surgeons, all types of medications, so forth. He suffered with a number of things, of which lumbar spinal stenosis was one of the main ones. One of the key things we did with Jeremy is let's determine exactly what's causing that lumbar spinal stenosis. And so in Jeremy's case, it was a number of things. There was severe lumbar spinal stenosis as shown on his MRI. there was disc herniation, there was degenerative disc disease. Jeremy went through one of our non-surgical robotic laser spinal decompression programs. It's what we call neurospinal restoration, which has at the heart of it has the non-surgical robotic spinal decompression, but it also includes a number of other things to address all of those factors. Jeremy went on an 8-week program, and 8 weeks later, 0 side effects, incredibly safe procedure. 8 weeks later, on MRI, we could see on pre-MRI and post-MRI that the disc herniation actually receded by half. We could actually see that pressure came off the lumbar spinal stenosis. We could actually even see increase in disc height as well. And Jeremy is back to doing the things that he wants to do. It's an amazing change. And you need to understand how frustrated Jeremy was. Jeremy was actually contemplating getting surgery done in Germany. And I should also let you know, if I mention any patient on camera, obviously they've given me their permission to share their story. Jeremy was going to get surgery done in Germany. He was quoted $65,000 to get this surgery done, and was told 3 months later he might be able to start driving a car again. I understand the $65,000 is certainly not about the money, but the $65,000 did include travel and lodging and downtime and everything else. But the almost frightening thing about Jeremy, and this gets back to the dangers of surgery, is not in the small fine print, but in the big print. Jeremy was strongly advised by the surgeons in Germany to go donate to a sperm bank. Now you're going to think, okay, well that sounds a little crazy, until you understand, remember those same nerves that exit the lower back go to the bowel or the bladder, we talked about that, go to the reproductive organs as well. So in this particular type of surgery, there is a 2 to 4% chance that they would have ruined Jeremy's ability to ever produce a child afterwards. And hence he was strongly recommended to actually donate to a sperm bank prior to the surgery. Jeremy is thrilled, his life is back, he's able to do a lot of things that he wanted to do. He will tell you that no way in the world could he go back to work or continue to work if he was how he was before. All of these things are possible even with a severe lumbar spinal stenosis. Okay, and finally, let's get to the one bonus tip that I promised you right at the start. This particular exercise is not only one of the exercises that we use here in our health center, but is actually used at some of the leading spinal stenosis boot camps throughout some of the hospitals in Toronto. This particular one, what I want you to think of is, think back about the main causes of spinal stenosis. We saw a lot of these things that were putting excess pressure on the spinal canal, on the spinal cord, and on the nerve itself. So we want to do the opposite. We want to go into a flexed position. So the very simple one to do is a simple knee to chest exercise, where you bring the knee forward, you bring it to the point where it feels comfortable and you feel a good stretch. This is one of the mistakes a lot of people make, is they simply go through the motions. What you really want to do is you want to feel that good stretch, and then the question is, well, how long do you hold it? There's no magical number. You hold it long enough until you actually feel a good stretch, and then that the stretch actually eases up, so you know you've accomplished what you're trying to accomplish. You're going to do the one side, then you're going to move over to the other side as well. So again, we're taking a what some people consider a very simple exercise, but when done properly, can make a huge difference. It's going to start to take some of the pressure off that nerve, some of the pressure off the spinal canal. After we've done each leg on both sides, then we're going to come back and we're going to try both at the same time. Now again, be careful with this, okay, because a lot of people who are suffering with spinal stenosis, okay, what's happening is they have more than one thing going on. So in this flex position, you should actually start to feel some relief. Do not forget to breathe properly while you're going through these motions. It's not a holding your breath test, which so many people do. And again, you're waiting to actually feel the stretch ease up. And then last but not least, to put one more final added touch, is we're going to try opposite sides here, where you see the right leg is coming over. Okay? And again, you want to feel a nice stretch through that area. Again, go to the point where it's a good stretch. That old adage, no pain, no gain, does not, never has, never will apply to stretching. If you're finding it sharp, if you're finding it's coming down the leg at all, or you instinctively feel like you're doing some damage, you back off right away. And then again, last but not least, we're going to finish off with the opposite leg. Look how very specific the movements are. Look at the intention. So again, it's not going through the motions. Let's focus on what it is that we're actually trying to accomplish. And this will make a world of difference. It only takes a few minutes just to do this one simple stretch. We have a number of them, but again, they're all specific to what you have. So again, that's why coming up with the underlying cause of your lumbar spinal stenosis was so important right at the beginning. Now, I want to hear from you. Tell me about your experience with lumbar spinal stenosis. What have you tried that actually worked for you, or at least gave you some temporary relief? What have you tried that didn't work for you? Please leave a comment in the comments below. If you found value in this video, please go ahead and give it a like, and also share it so people can learn more about the causes, the symptoms, and the unique treatment of lumbar spinal stenosis that we do here in our health center. And if you want to learn more about robotic laser spinal decompression, simply go watch the video where I go into more detail about robotic laser spinal decompression. Please go and watch the video that you see on the screen right here.